We're with Dr. Carlotti at the Carlotti Cosmetic Center. Doctor, tell me, there are some people that don't like their nose. What are the options currently?
Noses are unique in that they're at the center of your face, and patients often like to just change subtle aspects of their nose so that maybe their soft facial features match better with their nose. Options are cosmetic rhinoplasty, where we reshape the nose, and that's a surgical procedure. Sometimes there can be things that we use filler on the nose to help reshape the nose, but primarily it's a surgical procedure.
Now, during rhinoplasty, do you have to always completely break the nose and redo it, or what does that really entail?
Well, a majority of work on the nose does involve what we call the dorsum of the nose. And if it's very wide and you're removing a bump on the nose, you have to sometimes just gently narrow the nose by setting these bones in towards the middle. Otherwise, they'll look flat on the bridge of the nose. That's where we tend to have to do the break, which, by the way, is done all inside the nose. It doesn't change the recovery at all.
And for people who just want maybe just a little wider nose or just the tip, is that a pretty simple surgery, or is that still an extensive surgery?
Rhinoplasty is perhaps the most technically demanding surgery we do in cosmetic surgery. It is the art, it is all art. Every nose, every face is different, so every operation on every nose of every face is different also.
And now Dr. Michelle Carlotti is going to share with us, how young or old can someone be for rhinoplasty?
The reality is we'd like for the child to have completed growth, and for most females that's about 3 years after they've gone through puberty, and for most males about that long and maybe an additional year.
What do you see on that other end of the spectrum?
What factors into that opposite end of the spectrum is sometimes patients just haven't liked the way their noses looked most of their life, but frequently it's just facial aging in that the cartilage gets softer, so the tip comes more downturned. They may not have the same definition to the tip, and they seek that definition back, and in turn that rejuvenates the face.
Well, thank you, Dr. Carlotti, for sharing this with us. I think that rhinoplasty is a lot easier than what most people assumed it is, and there's just so many different reasons to have it. And if you're going to have it, you definitely want to come to the Carlotti Cosmetic Center. Thanks, Michelle, for joining us.
You're so welcome. Thank you for having us. Everyone has questions. We're here to answer them.
We'll help you make the decision that's right for you.
We are Michelle and Albert Carlotti.
For more information, contact the Carlotti Center, 480-947-7700, or log on at www.carlotticosmeticsurgery.com.